This is the idea of screening people, offering them a genetic test before they have a baby in order to test whether both parents are carriers for the same very rare recessive genetic condition.
Hello, I'm Dr. Amit Shetty. Welcome to the Future Health Podcast. This is the podcast about the way we work, the work we do, and how technology will influence the future of work in New South Wales Health and the healthcare industry as a whole. Our guest today is Dr. Lisa Dive, a bioethicist at the University of Sydney. Dr. Dive has a deep research background and will be here to answer the question, just because we can, does this mean we should? And I'm looking forward to digging deeper into the future of work with her. What is bioethics and how does it relate to the future health and the future of work? Well, we are about to find out more. Dr. Lisa Dive from the University of Sydney Health Ethics Centre. Welcome.
Thank you very much.
As you know, we are here to discuss about the future of work, worker, and workplace. It'd be great to get a bit of your background and understand where you are approaching this and how this is the challenge you're facing at work at the moment.
Yeah, sure. Thank you. So my background is, as you said, I work at Sydney Health Ethics, which is a bioethics centre within the Faculty of Medicine and Health at Sydney University. I'm actually a philosophically trained bioethicist. So my academic background is in analytic philosophy and also in bioethics, mostly theoretical bioethics. So in addition to that, I've worked in health policy for about 10 years. So I have that practical understanding of the health system in Australia, the health workforce and the different components to it. But I think because of my training, the way that I would approach issues is very much in that analytic philosophy tradition of questioning and interrogating concepts and thinking about why we're doing things and what we mean by certain things that we're talking about, so that we can really have conceptual clarity to inform our approaches to all sorts of different practical issues.
It's interesting though, whenever people talk about bioethics in these days and times in medicine, seems to be very projected towards genetics and genomic bioethics. I know you've done a lot of work in this space, but it's not all about that, is it? So would you like to talk about where we are at now and how else do you see the whole bioethical impacts through workplace and worker?
Oh, look, well, bioethics is a very broad field. And what's really fascinating about bioethics is that it incorporates lots of different perspectives on the problems facing health and healthcare. So if you really, the way that I would think about bioethics is very broadly to include anything that impacts on the health of populations and people in it. So that sounds very vague, but it's really like it has to do with how not only healthcare systems and how we deliver medical care, but anyone who has anything to do with that system and also the other things that affect it. So things like food security and the environmental impacts of different policies and things like that. They all have a role to play, I guess, in bioethical considerations.
Yeah, and as you highlighted before, one of the key challenges is that it impacts every aspect of our life rather than just health as such. How do you see, what are the areas in direct patient care you see where the biggest challenges or the changes that are occurring and rapidly happening because of the adoption of new technologies in this area?
Okay, well, as you mentioned, genetics and genomics, that's a particular interest of mine. I'm working at the moment on a project to do with reproductive genetic carrier screening, and that's a really interesting area. I might use that as a case study to illustrate some of the ways that some of these issues are coming out. So this is the idea of screening people, offering them a genetic test before they have a baby in order to test whether both parents are carriers for the same very rare recessive genetic condition. So if both parents are found to carry the same rare recessive genetic variant, then they might choose to take some options like assisted reproductive technologies or different things they might do to avoid having a baby affected with that condition. So this is an example of taking genetic testing or genomic testing, which has traditionally been more of a clinical kind of an intervention where a person or a couple or a family might decide in conjunction with their clinician whether that test is relevant for them, if it's important for them, if it's going to be useful for them. And then they'll be delivered the results in that clinical context as well. But we're talking now of where Australia's currently doing a pilot project to see what it might look like if we expanded reproductive carrier screening for the whole Australian population and made it available to everyone. This is a project called Mackenzie's Mission, which is federally funded. But the ethics of taking a clinical intervention and then rolling it out to the whole population, making it available to everyone, raises a lot of really interesting ethical issues, because you lose that customizability that happens at that interaction between the clinician and the patient. And you also have to think about you have to think about not only, of course, people should nobody's going to be forced to do this. It's about offering everyone the choice to consider whether it would be right for them. But people need to be supported to understand what the implications would be for them if they have that kind of screening. And then also we need to think about beyond the individual participants in a program like that. We have to think about what is such a program going to do to Australian society. Is it going to have macro level societal influences on cultural norms and things like that?
It almost sets up a scene for genetic preselection, don't you think?
Well, yeah. I mean, there is this idea of eugenics and shaping the sort of designing or choosing what people will be born in the future. And that has as you know, a really terrible history. So there have been obviously lots of efforts to distance the current practice of genetic medicine from those sorts of things that went on in the past. But it's still the case that if we implement a broad population screening program and allow people the freedom to choose whether or not to participate, even with that freedom, they still might make choices that result in fewer people with genetic conditions being born in society generally. And then we have to think about, what is that going to do to our society? It might become less accepting of people who are differently abled and different in different ways. So
yeah, you make a really good point there, because as we're talking about worker and workplace, clearly there could be worker preselection based on susceptibilities to diseases they can or not take care of, but that could be seen as a positive. How do you deal with that sort of conundrum if it was, let's say it was another case where you were to deal with this in a scenario, saying who are the workforce I choose to work in the front line because of reduced susceptibility to infections and trauma and PTSD sort of decisions. Who are the best workforce? Do you see any role in that space, and how would you ethically?
Oh yeah, I mean, that sort of genetic discrimination is something which is possible in the workplace. Obviously, it could be a really significant factor. And when we're talking about roles that have particular functions, that could definitely be an issue. Another thing that's really important to consider from the workplace perspective is when we talk about genetic conditions and their prevalence in society, often they appear as different forms of disability. But when we think about the concept of disability, it really has two parts to it. So there is the actual features of whether the physical or mental features that are associated with the condition, but there's also the socio-environmental factors that determine the level of impairment that person will experience as they function in the world. And this is where workplaces can play a huge role in either elevating or diminishing the acceptability of people with difference and disability in our societies.
Yeah, and it almost throws up the whole challenge, and I'll look it back to diagnosis in medicine as well, is that there's always this black and white line between diagnosing disease based on a therapy you can provide, and you see there's a creep as soon as a new therapy comes in of that diagnosis threshold dropping further and further. And how you define ability and disability for that matter, because how does that play out? So do you see those definitions changing going into the future?
Oh, I mean, they're very difficult definitions to pin down. I think hundreds of years of thinking about it hasn't really nailed an easy solution. But I think those kinds of concepts, it's really important that they're very, to some extent, they are very socio-culturally determined. And so it's really important that as a community, we continue to have those conversations about how we understand those kinds of things.
Okay. I'm just going to bring you back on the analytic philosophy piece of bioethics and how you see that impacting diagnosis therapies in care, and especially around the challenging times we have at this moment. How do you see that playing out in health, and how do you see the next 10 years playing out and where we are headed?
Oh, okay. Well, I don't know if I can quite answer all of those questions, but I think, as an analytic philosopher, what I would do when faced with any kind of a complex question is always to take a step back and think about the bigger picture. Think about why we're doing something. What are the concepts and ideas that our rationale for a particular approach are based on? So if you're thinking about introducing a new kind of a treatment or a new kind of an intervention or a diagnostic test or something, because you have some shiny new piece of technology maybe or something like that, you have to be aware of, things can be very hyped when they're new and they do really fancy things. So it's important to think about why we're doing something, what are the ends which that is serving, and is that ultimately going to be beneficial or harmful to the people who receive that intervention or that test or whatever it is, and also to think about the consequences for groups of people in society, the society as a whole, and thinking about things like how systems are structured can do things like they can either mitigate inequities in society when there are different groups which are more disadvantaged than others, or some interventions can actually work to ameliorate those inequities. So we have to really think about, try and think in a really systematic and rigorous way about what the impacts of something might be, and also why we're doing it. Think about the rationale behind it and interrogate those concepts really thoroughly.
Are there any current bioethical issues you see in the delivery of medicine which needs to change significantly so we can take the next step towards improved patient care?
Look, I think one of the big challenges in patient care and in healthcare delivery is the very individualistic focus that we see on a particular patient and their freedom to choose whatever kind of care they think is best for them, supported of course by healthcare professionals. But I think that very individualistic focus misses out on so much. So every individual person is socially situated within a network of people, and they have employers, they might have employees, they have a housing situation, they have family members, they have lots of different contextual factors that impact on their health and their sort of social situation more broadly, particularly maybe when we're thinking about the way that healthcare services are delivered and the way that we design healthcare systems. I think it could be helpful if we pay more attention to the connections that we have between people, that we're all part of the same community, and that drawing up and looking at the bigger picture, thinking about the ways that particular ways of designing services might impact different groups in society, and really thinking about how we can design our system to be as fair and effective as it can be for everybody who works in it, who receives care from it, who doesn't maybe need to receive much care but lives in a society that benefits from the existence of that system.
Yeah, it possibly goes back to what you were highlighting before in your area of interest around gene therapy. Some of those can be so expensive. How do we develop a sustainable healthcare delivery system of the future and yet be able to meet the needs for certain minorities when it is ethical to do so, rather than... I always, in the clinical world, I have that dilemma between choice and options to be provided. And there is always this pull on, do we provide options which we know do not provide the right outcome for the patient as a specialist in that field?
Yeah. In the clinical setting, obviously, a clinician is always going to try and provide the very best quality of care for the patient that's in front of them. They should prioritise that patient's needs because that is the nature of clinical care. But I think also we can't ignore the public health considerations in the way that services are structured and delivered and offered and distributed and funded and things like that. So I think and similarly, if you're doing public health, you can't ignore the fact that particular individuals will navigate that system in very different ways. So I think to focus narrowly on one particular perspective is always going to be limiting, and that we can benefit from some sort of richer integrated thinking if we make sure not to ignore the public health considerations but also factor in the particularities of different situations and contexts.
And it does go back to designing systems as well, doesn't it? Because I always believe a system delivers what is best designed for. And I think for years we've been focused on delivering therapies rather than fixing problems, which means changing the lens of how you design a system to meet that. One of the other big challenges healthcare faces now, which I think is obviously the explosion of information available and the use of data in the selection or preselection of patients and therapies that can be delivered to them, apart from just genomics and the phenomics of the patient and phenotyping of patients. Where do you see that headed in the future, and how do you see that on the bright side and also on a not so bright side for the future?
Yeah, look, I was involved in a project which looked at the attitudes of Australians to sharing their biological samples and the associated data with biobanks that networked then with other biobanks or internationally. And I think one of the main things that we really took away from that is that Australians really are generous and altruistic when it comes to sharing their data. And if you have participated in research or you've had a test of some sort, often people are more than willing to contribute their data into some great biobank database somewhere for the greater good of medical research and developing better healthcare in the future. So that's a good thing. But I think one of the most important things in that kind of a situation is trust, because people need to trust that their data will be used in ways that are consistent with their values and their beliefs and their preferences for how that should be used and the kind of uses that it will be put to further. So I think if institutions and the way that they're set up and governed can think about the way that they can demonstrate their trustworthiness and earn the trust of people who are giving them their data, then that can become like a virtuous circle where people will in turn observe that trustworthiness and that their data is being used in ways which are beneficial to society more broadly and also protect their interests. So I think that trust component is really important in that kind of setting.
What do you see are the big challenges for new technologies coming in which are helping clinicians identify patients better, such as AI, machine learning, and the ethics of using those, and how they would change the future of patient care?
Look, I think one of the really interesting things with artificial intelligence is that when you have a machine algorithm which is learning how to think like a person, you need to program it with a whole rich range of built-in assumptions. And some of those will include ethical assumptions, things about what it should value, what it should prioritize if there is a conflict. So, I mean, this isn't so much in healthcare, but a simple example that everyone can understand is when you would have heard about this in the context of driverless cars, where they have to be programmed to decide whether they're going to hit a pedestrian or crash and harm the people who are inside the car. So those kinds of things have to be thought through in advance. Obviously, AI in the context of healthcare is going to be a lot more complicated than driving a car. And so the kinds of ethical assumptions and sort of premises that are built into that software which drives the AI are going to be really important to clarify and to make really explicit. And there will probably be limits to what the artificial intelligence can do. I think there'll always be a role for that human factor, particularly around the ethical considerations in healthcare.
Yeah, because you could easily introduce racial and gender biases into a lot of the algorithms that you develop.
Absolutely. And even unconsciously, because they're just built into various
and exclude
aspects of our society.
Certain groups from getting therapies they might have benefit from just from the design of those algorithms.
But actually, we know that our current system and our current society has a lot of very deeply entrenched inequalities between different groups of people in society. And so if we introduce machine algorithms, if we lay them on top of that, we risk that they actually exacerbate those inequities and make those inequalities more stark, which would be obviously
It'll definitely
harmful.
be a very interesting next few decades of journey as well.
It really will.
Thank you so much for coming in and sharing your thoughts on what the future of health looks like and the future of work.
Thank you so much for having me.
So that's all we have time for this episode. Thanks for joining me on the show. If you enjoyed the podcast, make sure to like, share, and subscribe on whatever platform you are on right now.